Hello and welcome to HSM 430. We are starting this course with communication, discussing communication and health. And for this class, there are a couple of learning objectives. The first is introducing what interprofessional collaborative practice is, discussing elements of communication, differentiating between verbal and nonverbal communication, and then finally talking about steps to effective communication and some of the things that are important to know for effective communication. So starting with the first learning objectives, why is interprofessional collaborative practice important? Why have we been pushing this idea for the last couple of years? The reason is because there is strong evidence to say that having interprofessional collaborative practice is key to achieving safe and high quality health care. So the reason being that because the principle of interprofessional collaborative practice promotes that healthcare professionals are in communication with each other, they're in consultation with each other, they're collaborating, and this way they are able to have a better overview of what's going on in a patient's care, and they are able to deliver high quality health care that has the patients at the very center of it, with the patient's health care and quality of care being the core focus of it. And so interprofessional collaborative care is very, very important. Particularly, it's important in all areas of health, but it comes in very, very handy when it has to do with chronic conditions. An example would be, say, a diabetes management program. And in a diabetes management program, there are various healthcare professionals that are working with just one patient. You have the primary care physician, you have the ophthalmologist, you have the endocrinologist, you have the podiatrist, you have the dietitian, and you have the nephrologist. So these are healthcare professionals with in their various specialized areas, coming with their specialized training, but they are all speaking to the same patients, and somehow the same patients needs to be able to fit in every advice and every recommendation from these different specialties into their life. So it's important to have the dietitian communicating with the primary care physician so that they are all reinforcing the same advice and not giving advice that is, for an example, in contrast to one another, or that may sound to the patients that these are two completely different things. So that is one of the reasons where interprofessional collaborative practice comes into play. So an interprofessional collaborative team includes the patient. It has to include the patient because this person is at the very core of the care, and his or her own opinions and perspective has to be put into consideration for any care that is being delivered. The families of the patient is also very important because some of the times the carers are coming from the family, so you want to be able to be communicating with them so that everybody is all in the know about what's going on with the patient's care. The community is also very important. The reason because is when we talk about adherence, especially to medical advice, when healthcare professionals speak to patients as if they are not a part of the community, some of the advice that they may be giving may not align with community values. And so you have the patient struggling to do what the medical professional has advised versus what is applicable in the community that they fit in, and they would feel that if I go with what the medical people are saying, I will not be able to fit in with my community, and that creates some sort of challenge. They may not be able to adhere to medical advice as much as they would have. So it's really important to when you're speaking with a patient, to bear in mind what community they're coming from, to be able to situate your advice into the cultural or community norms, social norms within that community. And for best care, there needs to be collaboration among all these various professionals in the management of the of the patient's care with the patient, the family, and the community input being very, very valuable to it. So if the patients and the healthcare professionals are meant to communicate with each other and among themselves, communication and how to be able to do it effectively is something that cannot be underemphasized. And so you want to be able to talk to one another and to be able to understand one another. So communication comes in very importantly when we are talking about interprofessional collaborative practice. So it's a very vital and critical skill. It helps us in effectively transmitting what our needs and wants are. It helps informing bonds and rapport. Rapport being a relationship and very much enshrined in there being mutual trust and mutual regard between the people who are conversing. So the patient wants to feel a sense of trust in the healthcare professional and holding them in high regard, and also the patient wants to feel that the healthcare professional trusts and hold them in high regard. So it's very, very important for that. And then communication, of course, has to do with transmitting information to and fro between the provider, the patient, and all the other people involved in it. So what do we do with communication in such a way as to make it effective? So that's where we come in with the elements of communication. So the element of communication tries to identify all the key players and all the key features of an effective communication. First, we have the message, in this case being the idea or information we wish to convey. In this case, this lecture, for an example, is the message. I'm trying to communicate the importance of interprofessional collaborative practice to you. And then the sender would be, in this case, could use the course itself being, I'm the sender because I'm the one who is initiating this communication. I'm the one who is transmitting it. So I have the message and I'm transmitting it to you. But Southeastern University can also fit in as a sender, because in this case you're able to learn about this because you are a student of Southeastern University. But at the same time, Southeastern University can also be seen as being a channel as well, because it is through the verbal and the written mediums that the school provides that you are able to get these messages. So channels can be verbal, can be non-verbal, and it can be written. So the receiver in this case would be the person in which this message is intended. In this case, you guys, the students, are the receivers of this message. The feedback is the response that I will get from the students, from you guys, to let me know that the message that I intended to send, whether it actually got, it was received by you or it was, understood by you. And one of the ways that I can get that feedback is through assignments. So when I give you assignments, is my way of assessing whether the message that I, transmitted or I communicated was actually received in the manner that it was intended. So, and very, very important aspect of feedback is clarification. That's seeking to know, understand more of the information, because you have to be able to seek clarification to be sure that what you heard is actually what was intended to, because that's one of the things about communication. Communication is just not about hearing what someone said, but trying to make sure that what you heard is what you were intended to hear. So clarification is a way of making sure that happens. Then you have verification, in which you then, as a receiver, indicates that you have understood. One of the ways that verification usually happens, especially in a non-verbal way, is when people nod their heads or they smile. So usually you find sometimes in a conference or something, the speaker kind of focuses on one person, and when the person, whatever facial expression the person has, the speaker uses that to gauge whether what they're saying is being understood or not. So that would be verification. So, what are some of the interprofessional competencies that one needs to know as a healthcare provider to as a way of communicating effectively? The first is that when you're meeting a patient or any health consumer, you need to communicate what your role and responsibility is, and you need to be able to communicate it clearly to the patients or whoever it is that you are speaking to, and that includes other healthcare professionals. To do that, you need to introduce yourself and explain what your role is in the care or in the program as need be, and you need to answer any questions that you may have that they may that people may have regarding what your roles and responsibility is. And then finally, you need to be able, this is an ideal situation, ask your patients to tell you his or hers or theirs understanding of what your role of responsibility is. So this third one is a way of doing the verification, whereby when you ask the question and they respond to you, and what they respond to you is in accordance to what you said to them, then you have verified that yes, they did understand when you communicated your roles and responsibilities. So the second competence is being able to communicate with team members, as the interprofessional team members, as a way to clarify each member's responsibility in executing whatever part of the treatment plan or a public health intervention as may be. And you need to, the way to achieve this is by clearly and accurately communicating the responsibilities as it relates to patients or the intervention program. Also, it requires continuous communication and collaboration. It's not something where you meet once and you never meet again, because that way you will not be able to keep abreast of everything that is going on. And then thirdly, you want to be able to prevent duplication of services and providing safe and effective care, and that is by communicating and staying within continuous communication and collaboration with each other as a way to prevent duplication of services. Then thirdly, interprofessional competence will be to explain the roles and responsibilities of other care providers. So if someone in the, let's say a patient or a carer of a patient comes and asks you, oh, this doctor or this nurse or this person who just left the room, she said something about this is what she's going to do for me, but I can't remember what that person said. You, as a healthcare professional who has been trained or has interprofessional competency, you need to be able to explain the role of that care provider who the patient wants to get more information about. So you need to know enough about what the person is doing, how they are doing it, in order to be able to explain it to the patient. So that's being able to explain your other carers' roles and responsibilities and how the team is working together. To do that, you have to be fully informed or informed in a reasonable extent what other professionals' roles and responsibilities is. And then you want also, and this is very, very key, you want to avoid intentionally or non-intentionally stereotyping a person or the professional. So because you could say something and it may lead to the patient feeling that you have devalued that other member's contribution to the care team. You don't want it to seem that maybe your role and responsibility is more important or more crucial to the patient's care than another provider, because that way you are devaluing that provider, and that is not going to lead to a better work with the patient on having the patient get optimal care. So how do you do all of that communication? Well, verbal and non-verbal elements of communication comes into play here. So with verbal communication, we are talking about oral communication, such as spoken words, everyday speech. Examples of everyday speech would be slangs. Slangs are generally informal. And then you have idioms. Idioms are well-known figures of speech. Well-known, kind of, because well-known depends on who you're speaking to, but generally you could use it being a well-known figure of speech. And colloquialism is, this is a regional phrases that I use. I'm going to use the example of soccer. So Americans say soccer. Where I come from, we say football. So if I'm talking to someone and the person says football, I'm immediately going to think about football and not soccer. I'm not going to think about it in terms of American football. I'm just going to think about it with the regular football, for an example. So that's what it means by colloquial phrases. And then you have jargons. Jargons are kind of unique. Professions. An example would be saying something is statistically significant. Now, statistically significant means something entirely different from significant. So, but someone who is not trained in statistics is not going to be able to tell the difference. They're only going to hear significant and think that you're saying the same thing, but you are not. So you want to avoid those jargon terms when you are in everyday conversation or oral communication with people who are outside that profession. Then you have medical terminologies, which are often in Greek or Latin languages that other non-medical terminologies, other non-medical people don't know what that means. And then you have written communication, and this includes medical notes, memos, letters, and faxes. So non-verbal communications are where things usually get very tricky. Because with verbal communication, it can be to a greater extent quite plain and simple for the most part. Non-verbal communications are very, very contextual and can be subject to misinterpretation or miscommunication. An example would be body language. So in a body language, you're exchanging messages without words. And then you have the paralanguage. Paralanguage, you have an example would be sighing, humming, laughing, volume, pitch, tone, often more important in verbal exchange. Why I say it's very, very contextual is because if you're coming from a place where sighing means one thing and another person sighing means another, when you sigh, the person is going to interpret it based on where they're coming from. They're going to understand it from that lens. Let me use, for example, if you say, let's say you have a patient's chart and then you sigh, and maybe from where you're coming from, sighing means, oh, this is good. But where the patient is coming from, sighing means disaster. They are just going to immediately panic because to them, by the act of sighing, you have told them that there is very, very bad news. So that is usually where that goes. And then you have the volume, the pitch, also very contextual, because some cultures speak relatively louder than other cultures. So anybody who is coming from a culture whereby things are said in a higher tone or higher volume, when the person is talking to another person who is coming from a different culture where they speak lower or more subtly, it will be misunderstood as being shouted at. So that's usually where it can get very tricky. And then you have incongruous. With incongruous, they're usually non-verbal cues that are inconsistent with the intended message. I'm going to use an example. If you came to someone, a patient, and you said, how are you doing? And the person smiles and says, I'm fine. But while they are smiling and telling you they are fine, they are wincing. You are immediately going to assume that they are not fine because their non-verbal cue is not consistent with the message that they are giving. And then it can lead to communication breakdown. So you have kinetics as well. Kinetics is kind of looking at body movements, is gestures, postures, facial expression, eye contact. It may be easy to read, but you kind of want to be cautious with it because that's also one of those things that can be very, very contextual and can have different meanings in different cultures. And then this is the very big one, because this is something that's very, very different. And I'm saying this coming from someone who is not from the Western world. The concept of physical closeness or spatial awareness is so very different from the way I see it understood here compared to where I'm coming from. Especially an example would be the idea of a personal space, and or what may be perceived as a foul or strong smell, and also may be limited to infectious control and stuff. And touch requires some procedures as well, not just because of trying to make sure that patients feel comfortable, but also because you may not know how patients are going to interpret a touch. So maybe your intention is to show concern and compassion, but that would not be how it is received. So that's why in certain situations, an unwelcome touch, which may be intended to show concern or compassion, will be interpreted as assault. So it's really, really something that is very, very important to kind of watch out for. So personal space. So the idea of personal space came from the anthropologist Edward Hall. So he had this idea of what personal space is. You had the personal space in A, and then social zone in B, public distance in C, and intimate zone in D. Sorry, public distance in C, intimate zone in D. The thing is, this is not how it is in every culture. Like it says in this image, contact culture in Latin America, Middle Eastern may prefer to be closer than non-contact cultures like East Europeans or Americans. So what is personal space can be very contextual and very much rooted in who you're speaking to and from what culture that they are coming from. So you may want to always ask the patient or the healthcare consumer which distance that they are kind of okay with, just so that you're sure, because you may think public distance is fine, but they would read it as you rejecting them, or they would read it as you saying that, oh, I smell, that's why you're standing so far away from me. So you want to kind of check in just to make sure that what's the message that you are sending is actually how is being received the way it was intended. Then finally, what are some of the steps to effective communications that you need to know? The first is to understand, how this works. So you have the preparatory or the introductory orientation. What happens here is you're introducing one another. You're kind of doing the whole icebreaker thing. You're trying to reach some kind of mutual agreement, okay, and we're exchanging information. Then with maintenance, now you're getting right into it. So you've done all the getting to know you, initial introducing yourself, and now you want to get right down to the task at hand. And you also want to make sure that when you're having that conversation, you're kind of keeping it on track by controlling the flow. You don't want it getting out of scope, or being derailed and having things that are not intended to be discussed, then somebody bringing it up, because it can just throw everybody off beat and they don't know what it is that's what are we here to talk about, because it has suddenly been sidetracked. And then termination. At termination, everybody knows, okay, we are all done, we've discussed everything that we need to discuss. It's been a successful exchange. We are all very satisfied with whatever has been agreed, and we know what has been agreed, and now let's all go our separate ways. So the goal of the patient need has been achieved, and now people can go off and do what it is that has been agreed to do. Then you have sympathy, empathy, and compassion. With sympathy, you are showing concern for another. You're feeling sorry for them. With empathy, you're not just feeling sorry for someone else, you are feeling whatever it is that they are feeling. For example, if you see someone who is sad, you may feel you may feel sorry for them because they are sad, but that doesn't mean that you necessarily feel sad as well. So if you're feeling sorry for them or trying to understand, this is not a nice thing that happened to you, that would be sympathy. But when you start feeling sad in the same way that they're feeling sad, that would be empathy. And empathy generally drives compassion and in taking steps to reduce a person's distress. So it's not enough to feel what another person is feeling. You need to show some kind of actions that you're trying to help reduce the patient's distress. So there is something that is called compassion fatigue, and this comes in for many healthcare providers because taking care of patients who are usually experiencing pain or loss can lead to some exhaustion in the part of the healthcare provider. So that is where compassion fatigue comes from, and it does have effect on healthcare providers' own physical and mental health. So that is something to know as a healthcare provider, that there is a risk that you could experience this. So what do you need to learn from communication failures? First of all, you want to avoid establishing a dependent relationship with patients in such a way that patients are hanging on to your every word, whereby it feels as if they are not able to function without you being there to direct their actions. So you want to kind of avoid that, because when you do that, you are disenabling the patient to be able to take responsibility for their own health, because there is a degree of responsibility patients need to take in order to care for themselves when they are not in a hospital or clinical setting. So that's because the goal as a healthcare provider is also independence and continuing self-care. You don't want the patient to be so dependent that in your absence, the patient just kind of falls apart. You also want to be able to discourage patients from being dependent on you. You could do that in a very kind, compassionate way, but you need to make sure that you're doing that and be firm with that. So it's important to take steps to ensure there is a successful therapeutic exchange in the future with the patient. And to do that, you need to avoid cliched statements. You need to avoid stereotypical jokes. This is very important. Sometimes patients will not react when you tell these stereotypical jokes, but when they go home, they recall it in their mind, and they're like, I don't think I want to interact with this healthcare professional ever again. And then you want to avoid idioms, because while idioms are generally well known, maybe your patient doesn't know that and will be thrown off when you make this idiom. I wouldn't know what it is that you're trying to communicate. You also want to avoid imposing your own moral values on patients, because you don't want them to feel judged. So as a healthcare professional, you need to do your very best to address those values that you have, and remind yourself that you cannot impose that on your patients. You also don't want to be aware of kinetics and facial expressions. I know sometimes it can come kind of subconsciously, but you kind of want to do what you can to avoid that. And then if you don't know the answer to a question, be honest about it. Don't confuse the patient by saying things that are untrue. So that's that for today. Do remember to use the Q&A board if you have any questions. Do have a lovely day. Bye.